Dear friends, including um, colleagues, teachers, male, female, everybody. So as I wanted to do a video on nutritional care of the old people yesterday, which is supposed to be the International Day of the Viojanam. Viojanam means elderly people, the old, International Day of the Old. Or International Day of the Grown-ups. So my today's topic is, I'm going to say something about nutritional care at the end of life. Not really end of life, a few months, years before that. See, there is supposed to be a gross protein energy undernutrition. Protein energy undernutrition, PEU. Protein, everybody knows protein. And energy means the carbohydrate part of the protein is the protein, but energy is the carbohydrate or the fat, carbohydrate, all that, the quantity of the diet which we take. So there is a supposed to be a grossly inadequate protein energy malnutrition when you become past a certain age, usually after 70 years, because of several factors. Most of the time it could be because you have some medical illness or a surgical illness, something. But even without that, as a part of aging, you are likely to go into this malnutrition thing because because of two factors. One is you get anorexia. Right? Anorexia means you wouldn't have the drive to eat. Now you know the anorexia. The word meaning is you cannot go forward. Anorexia. So you don't have the drive to grab the food. Anorexia. It is defined as anorexia of old age because anorexia is in old age is because of several factors, not one. But it is mostly because of this the change in our it's mainly because of the change in the GI, gastrointestinal tract. So the gastrointestinal tract, our gastrointestinal tract remains almost same as young people's, as for old people also. But except for two or things. The one thing is that the motility in the esophagus. The food comes to you take it the mouth. From the mouth it goes to the back of the mouth called pharynx. Then it goes to esophagus. Malayalam annanalam, esophagus. And esophagus means like it's a kind of digestion, but not much digestion takes place inside the esophagus. Then because of certain factors in the stomach and the intestines. See, the stomach actually has what's called acid. So acid helps in assimilation of food, digestion of food also, assimilation of vitamins like vitamins and minerals, especially iron, and vitamins like B12. That has to be separated from the food. The separation takes place by the acid. So when you become a little older, there is a little less secretion of acid in the stomach. Right? So that will add to your malnutrition problem. Another thing is, then when we why we feel hungry is because we feel there is a loss in the this energy in the body, or there are signals are sent by certain hormones which tells you that you have to eat. Especially, there is something called insulin. The insulin is there. Then another thing is called leptin. Leptin, Leptin, leptin. These will tell you that you should be eating. The same thing will also tell you when you have finished eating, you have what's called satiety, you are full. It will tell you are full, don't eat any further. There is another two hormones also, it's called CCK. That will tell you don't eat any further, CCK. That is cholecystokinin, it is produced in the first part of the intestine. And that is the hormone which will ask the gallbladder to contract. So that the food will get digested. So CCK will act when a lot of food is there, and it gives you an anorexic signal. And also there is another hormone, it's called protein YYY, new hormone, protein YYY, triple Y. That's also supposed to give a signal that stop eating. So these are increased actually. Cholecystokinin, this thing is increased, levels increase in the old age. So this is why there is an anorexia. Even without any disease, you have you don't have. Coupled with that, there is another thing also. It's called hypodipsia. Hypodipsia means desire to drink water. So when there is hypodipsia, you have the desire to drink water is also reduced. And so most elderly people, it's according to one estimate, about 30% of nursing home residents or in care facilities have hypodipsia and dehydration. They may not be aware of it. But there are ways to diagnose this malnutrition and undernutrition. We don't say malnutrition as in young people. In malnutrition, what we studied is about protein calorie malnutrition in young people, deprived circumstances. Here it's not deprivation as such, but it's undernutrition. Either because you are starving yourself because of some factors. There are reasons why you don't want to eat. Also, apart from this normal anorexia of old age, you may have a subtle change in your psyche, maybe depression, some depression, you don't want to eat. Or you have constipation. Unfortunately, 2-3 things in the change in the gastrointestinal tract, this rectal problem, this storage, the constipation is quite common. So we have feeling of fullness in the belly, and so you don't want to eat. So such things can be there. So then these can also be diagnosed. So how will you diagnose this thing? Diagnosis is mainly by seeing the change in the weight. If somebody is losing weight, means there is he has undernutrition. Either because he is starving himself, or he has it's anorexia of old age. There is another name also. It is sometimes called as cachexia. Cachexia means you have all these changes. You don't want to, but cachexia is a non-specific term. Sometimes you attribute the name of cachexia to wasting because of disease also. Like somebody has pulmonary tuberculosis, or somebody has malignancy. He is losing weight. But cachexia is beyond your control most of the time. So either starvation or cachexia. So how can you differentiate between the two? Are there any? You have to make a diagnosis. Otherwise, there is no specific test other than testing your body weight. If somebody loses his body weight more than 5% of your body weight in a month, that means you have 10 times chance of impending death. If you are an old person, if you have more than 5%, that will be about 5-6 kilos usually. 5 kilo per month, 5 kilo. Maybe in thin person, maybe 2-3 kilos. So those who loses that much, there will a lot of chance for this depth. Then also, this loss of weight is associated with dementia also. If somebody is having a lot of loss of weight, that implies this impending mortality, especially in people having dementia. And demented people have this exaggerated anorexic response, and apart from that, they will have problems of eating because of various things, because of their problems with their oral teeth and all that, swallowing difficulty, and also they will have more chance for having. Dementia is a neurological disease. Dementia can be secondary to stroke. So stroke is one of the first causes for having oral or that is in the mouth and throat difficulty in swallowing, because the throat muscles will not act, in a productive fashion. They will not act synergistically. So they will act in a cross purpose. So you won't be able to swallow, especially thin liquids. You will have more difficulty swallowing thin liquids. So that is in a dementia. So and also, of course, those who have this dysphagia. Dysphagia means difficulty swallowing. The swallowing has three parts. One is in the mouth. Your tongue has to be moving together with your cheek and teeth and all those things, and push the food to the throat. That is a throat phase. It's called pharyngeal phase. Pharynx. The throat part is called pharynx in medical jargon. Mouth, pharynx, and the esophagus, the tube connecting the pharynx to the stomach. So esophagus phase. In esophagus, there is esophagus is a tube like intestine. It's part of intestine, and it has got peristalsis also. It's called peristalsis. The movement. The food moves by peristalsis. There is a muscle contraction. No? Muscle contraction, a coordinated contraction of the muscle fibers in the esophagus. So that peristalsis may not be occurring, or there may be some obstruction, some kind of block there, caused by cancer, or by some artificial thing like a web there, something obstructing the web, something making a block there. So sometimes they may be suffering from even medical illness like anemia, which can cause difficulty swallowing. So these things will add together and make an old person loses weight. Of course, we all know that when you become old, the muscles waste. It's called sarcopenia. Sarcos means muscle. So sarcopenia, because of various factors, sarcopenias. Because of old age is an inflammatory condition. There are a lot of inflammation is there. So that's one thing. Another thing is there is there's some hormones involved in it. So anyway, sarcopenia means you lose the protein part is the contracting part of the muscle, bulk of the muscle is a protein. So the protein is a protein losing thing. So sarcopenia. But if you feed proteins to the old person, you cannot restore the muscle bulk. The only thing which is effective is probably take him through some graded gradual exercise program, so to give him some benefit or some escape from the sarcopenia of old age. So I am tempted to say that these are end of life things, like sarcopenia and even dementia. One way, recently, yesterday I came across a news that somebody discovered cholinergic something, or what, some kind of monoclonal antibody which is supposed to reverse dementia. I really doubt it. This is actually degeneration, If you can find a reason for degeneration, you can find reason for death also. You can decipher death. You cannot do that. These are end of things. And your ability to reverse these things are really limited. So you can be a scientist and believe in science. I am one. But you have to be a realist also. There is a realistic, that realistic limit to our scientific understanding of the world. There is a limit, definitely a limit is there. So these are things which are unaware. But what can you do? How can you diagnose this thing? I told you loss of weight, one thing, make a serial weight thing. Then do all these things, you can check his arm circumference and leg circumference to see if he's losing weight. There are some simple questionnaires. Have you lost weight during the past 6 months? And you may not wait. Then you can say, is your clothes become loose, or your bracelet has become coming out of your hand, things like that. So that is another way of we can find out if he's losing weight. Or you can ask him. That will give him 1 point. Then you can ask him if he's lost his appetite to a marked degree, like he has lost 3/4 of his previous appetite. So that gives him another point. So you can make some diagnosis, some gradation. But unfortunately, there is no biochemical equivalent of making a diagnosis for loss of weight and anorexia of old age and this thing. Because even if you measure, people go by this secretory proteins in the blood, like albumin and pre-albumin and transferrin and all that. It gives a lot of... That will not tell you about his nutrition. It has taught to us that your nutritional status can be surmised from, you can understand your nutritional level by testing albumin and pre-albumin and all those things. It is not so. Actually, it is more related to the inflammatory state of the body. Of course, it's a health status indicator, but it does not tell you anything about protein, energy, undernutrition in the elderly. So what? How can you help the thing? If you are demented, you have to make a realistic assessment of his, his longevity, how long he will survive. So if it's a demented person, if you really make some effort and feed the person not through tubes, but by what's called comfort feeding. Comfort feeding means, the person should also want to feed because of your persuasion, and he will open his mouth. Generally, what this neurodegenerative people will do is they won't open the mouth, they will refuse. They will keep the food in the mouth. If they have no ability to swallow, of course you can understand, you have to feed them artificially. But artificial, as we will come there in a minute, artificial feeding has very poor prognosis. Artificial feeding is done through tube feeding. Another thing is you make some kind of entry to the stomach or small intestine surgically or endoscopically and put a tube there. So it basically boils down to tube feeding. This has a high incidence of, it leads to mortality. The person who would have lived without this intervention for a few days would die very soon because of what's called aspiration pneumonia. They will aspirate the thing which you are feeding him. So it is choking with food, he will die. So don't give food. See, when we come to the end of life question, whether we should give food, you will feel your loved father or your loved mother. So am I not doing my duty? She's not able to feed herself, so I have to get somebody to feed her, force feed her. Never do that, because when you don't, a person does not want to eat, actually they don't suffer so much. But the suffering will come once you put a tube through the mouth. It's contrary to my medical probably recommendation. And actually, they will actually suffer because of aspiration pneumonia. The documented that more aspiration pneumonia, the food will go into the lungs and the person will die of severe pneumonia. Very soon, or sooner than he would be starving. People can stay alive for a week without much food. Especially, another thing is, actually a person need not be fed if he has a fairly good body mass index. But if you can measure body mass index, very difficult to measure the body mass index, somebody who is stooped, because you have to get the height to get the body mass index. The body mass index is just weight divided by height in meter square. So height has to be there. But if you are able to measure height, you can say body mass index. Usual body mass index normal is between 20 and 30. But if it's even with 18 BMI 80, body mass index 18, the person can survive without even water for 1 week. So don't worry about it. It's not going to add to suffering. So I'm not talking about euthanasia. It's not euthanasia. This is reality. Now, people don't live. People become sick because of various factors, genetic factors, because of the environmental factors, or how they have been, and all those things. You can't help all these things. It's beyond medical science. So you have to accept that. So in nutritional thing, but somebody will ask, can't you give some, stimulant or appetite stimulant to make them happy? There is no such drug actually. Of course, some are given. Probably an antidepressant sometimes works. They call it mirtazapine. It's a typical kind of antidepressant. I don't want to go into the details of it, lest my medical colleagues would say this is too much. So mirtazapine is supposed to add to weight, but a lot of all these things all drugs have side effects. So you have to weigh risk versus benefits before you prescribe all these things. Or can you give some other drugs? I don't think so. So what can you do at the thing? And don't give, they may not be drinking. So what you can give, they are not drinking for a short period of time. What you can give is what's called not intravenous saline, intravenous fluid, but subcutaneous fluid, which can be given at any facility. Subcutaneous means put the needle under the skin, so you don't have to find a vein or anything. Probably add some, mix it with what is called some thing is there which helps it getting absorbed more. So that can be tried. Give fluids, but IV fluid should not be given for one reason, because it will add to secretions. As such, old people they cannot get rid of the secretions from the mouth and the throat and the lungs. So they'll be having this that they used to be called rattle. Rattle. Now that will add to the rattle, death rattle. It's called death rattle. If you give fluids, it will add to the death rattle. So what they do is, doctor will give IVM telling his son. The neighbor says, they insist, or take him to the hospital. This is not something being modern, You let the person die according to your tradition. See, we have several traditions of dying. For example, in Jain, they have, I think the time is, just tell you a story, By the way, why I'm not putting all these slides and all that, mine is just a story. I'm just appealing to your emotions. I don't want you learning all these things. So why in Jain community, people, they'll give up their body by starvation. It's a good way of going from this world. Starve for some time, without water, without food. Because as I said, it does not add to your suffering. Hmm? So there are several ways, but not the Talaikutal of Tamil Nadu. That is a kind of, it's not euthanasia actually. It's a kind of just a plain murder of your, because you're just disposing of the elderly. Talaikutal is I'm not talking about. Talking about other things. So you understand your limitations and you try to be solemn and help your dear ones, loved ones as much as possible. Thank you. Thank you very much.